Hey, my name's Carol, and I wrote the Constitution. So I just want to let you know that I didn't make notes on my hand, but I tried to post this pod a couple times and kept fumbling around the ideas and my words. So I did, ironically, make notes on the back of a medical bill. So let's discuss healthcare reform and what I'm going to call a platform that isn't politically motivated and is a peaceful forum in which our voices can be heard by politicians and lawmakers in this country. And hopefully they'll take note of what we, the people, have to say regarding healthcare reform. And in the future, we'll bring up some other topics. So I'm just going to start conversation what I'm going to call, instead of addressing it as a Tea Party whatever movement, I guess. Let's call this coffee house conversation, because I think this is the conversations we're having in most of our homes with our family and coworkers. So why do we need healthcare reform in this country? Because it costs too much. That's why. Because I don't know about you all, but when I go to the doctors and I have to, stay for more than an hour in a hospital, I get 5 bills from 5 different people for the same visit, because insurance companies are driving up cost of health care for small businesses and the people in America who can afford insurance. And most importantly, because health care preserves our inalienable rights of life, liberty, and the pursuit of happiness. And this is the government's place. The government's place is to protect the rights without infringing on our freedoms. So having said all that, I think it's important just to state simply, let's talk healthcare reform and address the issues aforementioned, and that's it. The quality of healthcare in this country is second to none, and I don't think that there's a need to regulate the quality of our healthcare, but to regulate the cost of our healthcare. Let's set some caps on the cost of healthcare in this country. Let's set some caps on the amount insurance companies can charge for premiums to Americans. Let's set some caps for pharmaceutical companies and make the cost of prescriptions in this country more affordable. Let's make medications available to elderly that are retired and sitting at home, that are sitting on Medicare and run out of the money that's provided for their medications by the 1st of December of each year, and go a month without having insulin to take for their condition, their diabetic conditions. Let's focus on the cost of healthcare and make that what healthcare reform is about. So this is my piece. Hopefully there's more of you out there that feel the same way, and if our voice is loud enough, maybe we can get the attention of some lawmakers in our states, and they can take that information and move forward to our national government. And remember, my name's Carol, and I wrote the Constitution.